Assalamualaikum doctor. In this video I am discussing a video station that is orbital cellulitis. It also comes on history. So orbital cellulitis, mainly unilateral cellulitis, very rarely bilateral can be occur. So eye swelling, bulging and swollen eyelid, discoloration or redness in the surrounding skin like that. The differential diagnosis we can keep: orbital cellulitis, periorbital cellulitis, conjunctivitis, trauma, stink bite, allergy, eye infection secondary to facial palsy, also leukemia, retinoblastoma, lymphoma, neurofibromatosis. What history we ask in orbital cellulitis? Onset, course and durations, what increase and what decrease, any diurnal variation. Eye symptom, is it red, painful eye movement, affection of the red and green vision, excessive lacrimations, oozing pus, any bulging eyes, light intolerance, is it affecting upper or lower eyelid or both, any proptosis or chemosis. So is it red, painful eye movement, affection of red and green vision, excessive lacrimations, oozing pus, any bulging eye, light intolerance, is it affecting upper or lower eyelid or both, any proptosis or chemosis. Then any swelling in any other part of the body and where started first. Any associated fever, headache, sign of increased intracranial pressure, any drowsiness, seizure or abnormal movement. Is it preceded by sinusitis, like any recent dental procedure, any history of trauma, sting bite or anaphylaxis. Any family history of similar condition, any chronic illness, especially nephrotic syndrome, diabetes mellitus and immunodeficiency. Any drugs he is taking. Now what examination we do? After involving my consultant, ENT, ophthalmologist, neurologist if needed or neurosurgeon. AVC vitals, conscious level, general examination for signs of sepsis. Eye examination and ENT examinations and neurological examinations. So AVC, vitals, eye, ENT and neurology. Investigation we are doing: blood, CBC, CRP, SR, culture sensitivity, imaging or CT of orbit, sinuses and brain, MRI brain. Others are swab from the eye if possible. What are the indications for CT? Suspected orbital involvement, central neurological signs, inability to assess the eye movements or vision, bilateral edema, deterioration despite treatment. Indication of our MRI is suspected intracranial involvement on the CT. So what is the complications of orbital cellulitis? These are on eye and on the neuro. Eye is orbital abscess, optic neuritis, blindness, exposure, keratitis, glaucoma, panophthalmitis. Neuro is cranial nerve palsy, subperiosteal abscess, meningitis, cavernous sinus thrombosis. Management team plus antibiotic and red flags. Periorbital cellulitis, review the eye movement and red-green color visions. And orbital urgent ophthalmology and ENT review within 4 hours for surgical drainage. Intracranial complication, urgent neurological review. So treatment options are: orbital cellulitis, we give ceftriaxone or cefotaxime IV if toxemic, add the clindamycin IV, and penicillin anaphylaxis, ciprofloxacin and clindamycin. If penicillin allergy, add clindamycin and shift to amoxicillin oral. Then duration is 21 days and 6 weeks if bone involvement. Periorbital cellulitis is upper eyelid, amoxicillin oral, both eyelids severe or no improvement after 48 hours, then amoxicillin IV. If penicillin allergy, clindamycin. If improving, shift to amoxicillin oral. Duration is 14 days. Indication for admissions are: suspected orbital involvement, fever, immunocompromised, no improvement after 48 hours of oral antibiotics and less than 1 year old. Sinusitis, we give if acute, treat with amoxicillin orally, change to amoxicillin if no response after 48 hours, IV if severe, and total 7 days is antibiotic treatment. So there is a very important question come: difference between periorbital and orbital. So periorbital eye can be examined, where orbital not. Periorbital only facial erythema and tenderness, but orbital painful eye movement. Periorbital normal eye movement, normal visions preceding superficial trauma, eye pain and periorbital swelling and fever. But where orbital actually preceding sinusitis, proptosis, chemosis, decreased GCS, headache, systemically child will be toxic and unwell. So this is this video station. Thank you.